Hi everyone, I am Ankita Majumdar. Welcome to my YouTube channel. Today I am going to teach you SST Political Science Class 7th Chapter 2nd Role of the Government in Health. So today we will learn about the role of the government in health. So first point is, what is health? We can think of health in many ways. Health means our ability to remain free of illness and injuries. But health isn't only about diseases. What we can often ignore is the fact that each of the above situation is related to health. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped condition, they will be prone to illness. Everybody wants to be active and in good spirits in whatever he is doing. It isn't healthy to be dull, inactive, anxious, or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of our lives are a part of health. Now, next is healthcare in India. The healthcare facilities like health centers, hospitals, laboratories for testing, ambulance services, blood banks, first aid boxes, etc., are strongly needed. These facilities can provide required case and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illness. We also need the medicines and equipment that are necessary for treating patients. These facilities are required to take care of us. India possesses a large number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public health care system. This is a system of hospital and health centers run by the government. Okay, our country has the money, knowledge, and people with experience but cannot make the necessary health care available to all. These all things we will discuss in this chapter, that why we are facing so many problems after having good doctors, medicines, all the facilities. After that, why people are suffering from different problems. Public and private healthcare services. Our next one is the story written above clear the various healthcare facilities can be classified into two categories. Here the story is there. If you want, you can read it. Okay. So that healthcare services, there are two services, that is public health services and private health services. So first we will discuss public health services. The public health service is a chain of health centers and hospitals run by the government. The services which is run by the government is called public health services. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kind of problems, from common illness to special services at the village level. There are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illness and work under the supervision of doctors at the primary health centers, that is PHC. Such a centers many covers many villages in rural areas. At the district level, in the district hospital that also supervises all the health centers. Large cities have many government hospitals, such as the one where, on that story, when you will read, you will understand that Aman was taken, and also a specialized government hospital, such as the one in Hakim Sheikh stories. That story you have to read. There are many reasons to call the health services as public. The government has established this hospital and health centers in order to fulfill its commitment of providing health care of all citizens. And the source to run such public health services is the money paid by the public as taxes. Thus, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality health care services, either free or at a low cost, so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. This has to be organized by the government with the participation of people, otherwise, it is not effective. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers, rooftops, etc., this has to be done for all houses in the area. As per our constitution, it is primary duty of the government to ensure the welfare of the people and provide health care facilities to all. It is the duty of the government to save the life of every person. Next topic is private health facilities. Our country has a wide range of private health facilities. Most of the doctors prefer their own private clinics than to serve in government hospital. In the rural areas, one finds registered medical practitioners, RMPs. Urban areas have large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as X ray, ultrasound, etc. There are also shops from where we buy medicines. Private health facilities are not owned to controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. These days, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals, and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. Healthcare and equality. Our next point is, in our country, the private services are increasing day by day, whereas the public services are running in the same situation. What is then available to people are mainly private services. These are concentrated in urban areas. As these services are run for profit, the cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. The private services encourage incorrect practices in order to earn more money. The cheaper and necessary methods are not adopted. For example, it is common to find doctors prescribing unnecessary medicines, injections, and saline bottles, water tablets, or simple medicines can suffice. Okay, we have seen that. In fact, barley 20% of the people can afford all medicines that they required during an illness. Hence, even for those whom one might not think as being poor, medical expenses causes hardship. It was reported in a study that 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possession to pay for the expenses. For the poor people, every illness in the family is a cause of great anxiety and distress. What is worse is that the situation tends to happen again and again. Those who are poor and in the first place undernourished, these families are not eating as much as they should. They are far from the so called balanced diet. They are not provided basic necessities like drinking water, adequate housing, clean surrounding, etc., and therefore are more likely to fall ill. The expenses on illness make their situation even worse. Sometimes the lack of money is not only the cause that prevent people from getting proper medical treatment. Even today, women's health concern is considered to be less important than health of men. Women, for example, are not taken to a doctor in a prompt manner. Many tribal areas have few health centers and they do not run properly. Even private health services are not available. So, what can be done? There is little doubt that the health situation of most people in our country is not good. It is the responsibility of the government to provide quality healthcare services to all its citizens, especially the poor and the disadvantaged. However, health is as much dependent on basic amenities and social conditions of the people as it is on healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. Next topic is the Kerala experience. The Kerala government made some major changes in 1996. Near about 40% of the entire state budget was given to village panchayats. They could plan and provide for their requirements. This made it possible for a village to make sure that proper planning was done for food, water, women's development, and education. This meant that water supply schemes were checked. The working of schools and anganwadis was ensured and specific problem of the village were taken up. Health centers were also improved. All of this helped to improve the situation. Despite this effort, however, some problems such as shortage of medicine, insufficient hospital beds, not enough doctors remained, and these needed to be addressed. Understood? So the next point is the Costa Rica approach. It is also an example. In South America, Costa Rica is considered to be one of the healthiest countries. The reason behind this is the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided not to have any army. This helped the Costa Rican government to spend the money that the army would have used on health, education, and other basic needs of the people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to the health of its people. The Costa Rican government provides basic services and amenities to all Costa Ricans. For example, it provides safe drinking water, sanitization, nutrition, and housing. Health education is also considered very important, and knowledge about health is an essential part of education at all levels. Understood, students? Role of the government in health. So here we have completed chapter 2nd. Your homework will be exercise, question and answer, glossary. These all things you have to complete it. Make notes properly. I will send PDF. Everything will be there. So you have to complete your notes time to time properly. Okay. And here we have completed chapter 2nd. Chapter 3rd I will explain in my next video. Till then, bye. Keep learning. Complete your notes. Thank you.